And now, a Buddy Check 13 reminder with News 13's Amy Hoyt.
Hi, everybody, and good afternoon. I'm News 13's Amy Hoyt. We are coming to you live on this Buddy Check Day from our newsroom on Harrison Avenue. And Buddy Check, as you know, is breast cancer awareness. Once a month, we remind you to check for lumps to make sure nothing's growing there. And if you feel something or there's something different, that you contact your doctor right away and get that mammogram annually if you're over 40 years old. We always have a special guest, and we have a very special guest today. She is a surgeon at HCA Gulf Coast Hospital. We're going to talk a little bit about breast cancer and the technology that now is available if you have to have a lumpectomy or mastectomy if you are a breast cancer patient. All right, her name is Dr. Jennifer Susoreny-Velgos, and she is live in our newsroom with us now. Thanks for being here with us today.
Hi, my name is Dr. Jennifer Susoreny-Velgos. I'm a general surgeon at HCA Florida Gulf Coast Hospital. I am originally from Northwest Indiana, and I did my medical school at Lincoln Memorial University, DeBusk College of Osteopathic Medicine in Tennessee, and I did my residency in Michigan at Beaumont Farmington Hills. Moved to Arkansas for 4 years and practiced right outside of Memphis, Tennessee, about an hour and a half from there, and then moved to Panama City about a year ago. So I currently work at HCA Gulf Coast Hospital.
That's right. The locals just call it Gulf Coast Hospital. We appreciate the acronyms, but we do. It's home to us. But we appreciate you joining us today. And I know that you're listed as a general surgeon, but you do work with women and breast cancer. So tell us a little bit about what you've seen in the year that you've been here, what type of surgeries you've done.
So since I've been here, I'm starting to see more patients with breast cancer. I just saw a lady a few days ago who has actually fairly large breast cancer. I've seen other patients who come in with just breast lumps that are sometimes just benign. We're able to offer imaging for those patients, ultrasound, stereotactic biopsies, ultrasound-guided biopsies at our hospital. So patients really don't have to go outside of Panama City in order to get care for any type of breast issue that they're having. If they are diagnosed with breast cancer, they can receive their care at Gulf Coast. We can perform lumpectomy procedures, mastectomy if indicated. They can see the oncologist. They can also get their radiation as well at Gulf Coast. So there's really no reason for them to go outside of Panama City unless, there's some unforeseen circumstance or something. But, typically they should be able to stay in Panama City.
Right. Now, in the year you've been here, you've done mastectomies.
Yes.
Yes. And I know what the difference is between a lumpectomy and a mastectomy, but how do you come to that decision? Have they already reached that by the time they get to the surgeon, or is it something you talk to the patient about?
So that's something that is very individualized based on, the patient's cancer, where it's located in the breast, the size of the lump. Some patients come in and they say, oh, I would like to have a breast conserving treatment or a lumpectomy, but, the cancer is just too large and they're just not a candidate for a lumpectomy. So it's a very individualized decision.
Right. There's a lot of different ways they can go. Some just do the one, some do the both. It just depends. I know.
Yes.
Right. And,
yes.
And you do coursework for breast surgery specifically.
Yes, every year I go to the American Society of Breast Surgeons conference that they have, and I've done additional coursework in oncoplastic surgery as well as ultrasound coursework. So I do additional training that is not required, but I choose to do it because I like to take care of breast cancer patients and other, patients that have benign breast disease.
Right. And we know as a patient and as a woman, sometimes we like being able to speak to another woman. So it's nice to have a variety of surgeons such as yourself who can speak to breast cancer and help obviously patients like that. You've seen a lot of different things, though. You must learn a lot about technology has just changed tremendously, even in the last year, maybe.
Mm-hmm.
Tell me about this. I know that there's a new procedure. You told me about the scalp procedure.
Yes, so we have a wireless localization device that we can use for patients who have either benign breast lumps or cancerous breast lumps. Basically, they go to radiology first, and the radiologist places a localization device inside the lump, and we use a probe in the operating room to help identify the location of the lump so that they don't have to get a wire in the breast. There's nothing wrong with getting a wire in the breast. Some surgeons still use that, but this is just a different technology that we offer at Gulf Coast. Just in the last year, we've started offering this.
Now, are you using that to test the lump? Are you draining fluid from it, or are you removing it?
Removing it.
Ah.
Yes.
So it's just so you're able sometimes in some cases to just take the lump out?
Correct.
Without cutting somebody open, so to speak.
Well, you do have to cut the patient open, but it helps to localize the lump in the breast. It makes it easier to find it intraoperatively and make sure that you excise the entire lump.
Okay. And lumps can be any size, can't they? It could be any from a pea size to, I don't know what you would call it, but they can be any different size, correct?
Yes.
And what do you recommend for women to do if they see something or feel something that's different?
So if they feel something or see something, they need to go to their primary care physician first and make sure that they let them know. Usually oftentimes we'll send them either to a surgeon who deals with patients that have breast lumps, or sometimes they'll send them to their OBGYN and they'll need to get a mammogram and sound.
What's the follow-up once you do have surgery for breast cancer? They meet with you again, or is your part done?
No, the patients do meet with me again. And usually I follow my patients long term. They'll come in, every 6 months just for a checkup for, basically indefinitely. And then they'll also follow up with the oncologist as well.
Okay. What other things do you see? Do you get any questions from women that like maybe something unexpected that they ask now? Or is it similar from patient to patient?
It's from patient to patient. We get a lot of patients who will come in with even just things that aren't necessarily, cancer. They might have like a rash on their breast. They might have nipple drainage. They have a cyst that could be causing nipple drainage. So there's all different things, benign things that, patients worry about, which makes breast complicated. And that's why I always go to the continuing education courses, because there's so much information out there that you have to stay on top of it.
And there's a lot of different breast cancers, which I've learned in the 2 years we've been doing these interviews, which is kind of a surprise.
Yes, that is true. There's a lot of different subtypes of breast cancer.
Right. What kind do you see or have you seen in your career?
I typically see invasive ductal carcinoma, invasive lobular carcinoma. I've seen inflammatory breast cancer. Those are the main ones that come to mind that I've seen, I think, most frequently.
Right. And does someone make an appointment with just the surgeon? No, they go through their primary first to get to you.
Usually they'll go through their primary, and it's always good for the primary doctor to know what's going on with their patient.
What's the recovery these days? If you have, let's go with the double mastectomy. A lot of women have that.
Sure.
What's the recovery like?
So the recovery is usually, a couple weeks to kind of start to get back to normal. Patients are going to have some chest wall pain, discomfort. The incisions are going to take a few weeks to heal. They're going to have drains in for a while. They might have drains in, for 10 days sometimes. So it depends. It's, each patient's a little bit different, but I would say, 2 to 3 weeks before they're really feeling back to normal again.
Right. Now, they say 1 in 8 women will be diagnosed with breast cancer, but the survival rate seems to have improved over the years. Is that because medicine's just gotten better?
I think it's just a combination of things. I think we're detecting it earlier. I think we have better medications, chemotherapy drugs. They're targeting the type of tumors. I think that's really some of the main things that have changed because patients are, for the most part, doing really well.
Now, we talked earlier before we started the live interview about men. It's only 1% of the population that gets breast cancer, but they can get breast cancer. And we've interviewed a couple of men in recent months. And so have you ever seen a male patient?
Yes. I had a male patient before I moved here when I was working in Arkansas. He was actually fairly young. He was like in his late 50s, and he came in. He had a breast lump that the doctor was treating him for what they thought was an abscess, and it didn't go away. And we did a biopsy, and it came back breast cancer.
Wow.
Yes.
And is there do you do surgery same as for a woman?
Yes, we did surgery on him. He ended up having a bilateral mastectomy.
Wow. So because we don't think of men when we think of breast cancer, it's more unusual. It's kind of like heart. The symptoms for a woman is different than it is for a man. Are symptoms different for a man when it comes to breast cancer?
Not that I found. I mean, they come in with the same things. They'll come in and say, I have a lump. I have something in my breast that shouldn't be there. And they, unfortunately, they'll go to the doctor, and oftentimes it doesn't get diagnosed right away because they'll think it's something else.
Right.
They don't expect to find a breast cancer in a male. So like my patient, they thought he had an abscess, and they kept treating him with antibiotics. And finally he ended up in my office, and I said, this isn't normal. We need to do a biopsy. And
so that's how it turned. That's how you prove that it is what it is,
exactly.
Right? The biopsy.
Yes.
Are you removing a part of the lump? What does the biopsy entail?
So it's just taking a small piece of the lump and sending it to the pathologist, which is the doctor that looks at it under the microscope.
Okay. What am I not asking you about breast cancer surgery that maybe you see or you would want women to know?
I think you've pretty much asked everything. I really would want patients to know that, I know it's a scary diagnosis, but there's a lot of resources out there, and there's a lot of people who can help them. There's a lot of other patients who've gone through the same diagnosis, and there's a lot of support groups out there. And Gulf Coast has an amazing nurse navigator. Her name is Kay. She's more than willing to help patients with any issues they might have. So I think, there's just a lot of people out there to help the patients with really any concerns they might have. Right. So there's really nothing to be, afraid of. There's always people to help you.
Right. Don't hesitate.
Yeah.
And check for lumps.
And make sure, make sure if you find something, always be on the lookout. And if you find something, don't be afraid, because you'd rather take care of it early than late. Wait and have a problem down the road.
Right. Or find out that it's nothing. There's always that relief. It could be nothing. Okay. Well, we sure appreciate you coming out and telling us what you do and what women can expect should they have to go through a surgery for breast cancer. Dr. Jennifer Susoreny-Velgos from HCA Gulf Coast Hospital. It's good to see you today. I would say welcome to the neighborhood, but you're kind of a local now. You're kind of over that line. So we're glad to have you here in Bay County.
Thank you.
All right, ladies and gentlemen, but mostly women, don't forget to check for lumps in your breast. Today is Buddy Check Day. That's why we wear pink, and we hope it's a good, timely reminder for everyone out there. We thank you for watching. We'll see you next time.